Americans spend an average of $1,100 per person per year on prescription drugs. That's more than anyone else in the world. It's true Americans take a lot of pills, but the real difference for the US is the price of those drugs, which many warn are rapidly becoming unaffordable. President Donald Trump has promised to bring drug prices down by forcing drug makers to bid for the government's business.
Pharma has a lot of lobbies, a lot of lobbyists, and a lot of power, and there's very little bidding on drugs.
Here's the situation. The pharmaceutical industry has come under fire for what critics have labeled price gouging.
Everybody's doing it. In capitalism, you try to get the highest price that you can for a product.
Martin Shkreli became the poster child of greed when his company raised the price of an old antiparasitic drug from $13 to $750 a pill. And in 2016, Mylan Pharmaceuticals CEO Heather Bresch was grilled by Congress when her company raised the price of an EpiPen more than twofold since 2012. So, how do drug prices work in the US versus the rest of the world? In Europe, governments negotiate directly with drug makers to limit what their state-funded health systems pay. In the US, drug companies more or less set whatever price the market will bear. Most of the costs are paid for either by Medicare, the government program for the elderly, or by private insurance. While Medicare legally can't negotiate drug prices, private insurers can. Private payers typically rely on third-party pharmacy benefit managers, or PBMs, like Express Scripts and CVS Caremark to negotiate discounts. PBMs often make exclusive and secretive deals with drug makers, which can result in an insurance company covering some drugs, but not others. In the end, Americans wind up paying about 17% of drug costs out of pocket. So here's the argument. Pharmaceutical companies say that high profits are necessary to fund research and development, and that regulating drug prices might slow medical advances. Advocates of regulation say lower prices wouldn't stop innovation, and point out that some drug companies spend more on marketing than they do on R&D.